Pilarski.
Thank you, Mr. Chairman. Thank you to our panel here today. You know, if it was possible and I could give congressional medals of honor, I would honor every hospice worker, every PACE facility, every federally qualified health clinic that serves the people of this country. I can't say enough about those services in my district. Unsung heroes, for sure. You know, workforce issues, lack of pools of people to hire and train, and those kinds of things. But I just want to thank all of you for being here and for representing those groups. I do believe that preserving Medicare is a priority. I do believe that we have to honor our promises to the American people and ensure that those who've worked their entire lives to earn their Social Security and Medicare benefits are able to utilize those programs during their retirement years. It's also important that we strengthen those programs so they remain available to future generations. I've been working with my colleagues on bipartisan solutions as well to support older Americans and communities across this country and help them lead healthy and independent lives. Some of these common sense bills that I've worked on, we've already talked about and heard about, but the Rural Access to Hospice Act, which would ensure patients in rural communities can receive hospice care from their local primary care provider. The Home Care for Seniors Act, which would help seniors access the care they need, allowing them to use HSAs for home health care. The Beneficiary Enrollment Notification and Eligibility Simplification Act, which would simplify the Medicare Part B enrollment process and help prevent lifetime late enrollment penalties. The Improving Hope for Alzheimer's Act, which builds on the Hope for Alzheimer's Act by requiring the Department of Health and Human Services to inform healthcare providers about care planning benefits available through Medicare, and H.R. 2693, a bill that will help Medicare beneficiaries with osteoporosis by updating reimbursements for DXA exams that are used in identifying and treating osteoporosis and at-risk seniors. I also worked with Congressman Blumenauer, as he mentioned, and CMS Administrator Verma on finalizing the rule for the Programs for All-Inclusive Care for the Elderly, or the PACE program, which gives more flexibility for PACE organizations, interdisciplinary teams, and allows certain non-physician primary care providers to offer services in the place of primary care physicians. And I do look forward to continuing to work with my colleagues on initiatives to lower costs and to improve access to care and services so more seniors can enjoy quality of life. Mr. Bannock, thanks for joining us here. I've appreciated listening to your testimony. I mentioned the Rural Access to Hospice Act, which I helped introduce with my colleague, Mr. Kind. Can you explain to the committee the statutory barrier that currently prevents hospice patients from seeing their attending physician that's with a federally qualified health care center, and how that hinders a patient's quality of life while at hospice?
Thank you, Congresswoman, for your leadership on this. Folks who get their primary care through a rural health clinic or a federally qualified health center are forced to make a really hard decision. Keep your doctor and stay with the rural health clinic and stay with the federally qualified health center, or choose hospice. But you can't keep both your doctor and hospice at the same time, which is insane. It's a bit like the choice we make folks go through in choosing hospice to begin with. Do I want hospice or do I want curative care also? What this bill would do is it would remove that barrier. You can keep your doctor, and that doctor can be your attending physician in hospice, which is a great step forward. Thank you for your leadership.
I appreciate it. Dr. Lynn, just wanted to thank you for your work. Like you, I'm a huge fan of the PACE program, especially after visiting a facility in my district last year. Realizing, though, that not a lot of my colleagues actually have the PACE program in their districts. So can you explain to them the innovative way they provide services and care to seniors with complex healthcare needs, number one, and do you have any recommendation on how we can expand this kind of care across the country?
Yes, PACE is marvelous. For a set price, they provide everything except housing that a person may need for people who are sick enough and disabled enough to be in nursing homes. So it's a very disabled population, and their record in keeping people at home and supported and safe is remarkable. Almost no one leaves PACE once they're in PACE. But PACE is effectively barred to Medicare-only people for reasons we talked about before. Part D has a bizarre regulation requiring that you buy the PACE Part D plan, which a Medicare-only person sees as going from roughly $50 to over $1,000 a month. So nobody will do that. We need to fix that. We need to probably allow there to be some PACE services ahead of nursing home eligibility. Nursing home eligibility, of course, varies by state, but many people need that kind of comprehensive service for maybe 6 weeks after hospitalization.
I got to cut you off right there. Thank you so much. I appreciate it, and I yield back my time. Thank you, Mr. Chairman.
Thank you, gentlelady. And without objection, I